What are the symptoms of a concussion and how do I treat it? The most common symptoms that occur after a concussion include headache, dizziness, sensitivity to light, sound, as well as difficulty with memory.
Sometimes even some vision disturbance, getting fatigued, some sleep disturbance, being more emotional. All of those things are going to be very common and expected, especially those first few days following an injury.
Sometimes we forget to talk to patients and athletes and their parents about the emotional symptoms that can occur after a concussion. So things like sadness or nervousness, anxiety, mood swings, as well as difficulty with sleep.
So the diagnosis of concussion is still challenging, which is why one really needs to see someone who's been trained in evaluating concussion. If you tore a cruciate ligament or some other ligament, we can do an MRI scan and we can see the tear and we can see the inflammation and the swelling. So if you image the brain and it looks perfectly normal, yeah, how can the brain be injured? But it is, because the brain is made up of 200 billion cells, each with lots of different wires and connections. And you can damage that at a microstructural level. And our imaging is just not sophisticated enough. You know, it's like looking at the moon with an amateur telescope.
We used to say rest is the best medicine. Unfortunately, some folks translated that into having folks almost sit in a dark room for weeks at a time, and that's not good either. That's a sure recipe for depression, if nothing else.
Those individuals actually take longer to recover. What we know now is that athletes need to be active.
We want the child to get back to their typical activities as well as they can endure them. So that may be getting them back to school within a few days after an injury, or getting them back to their typical activities, not involving any sort of contact.
Typically, we need to modify school. Maybe a shortened school day, a reduction in some of the assignments, or maybe some accommodations in school that gradually get weaned off as they recover.
If they're having a lot of symptoms, the last thing they need is the stress placed upon them, because that amplifies their symptoms. So flexibility in sleep schedules, social schedules, chore schedules, school schedules.
Technology is often a challenge after a head injury. We're often tied to our computers, our cell phones, or our tablets. The difficulty is these are triggers, so the bright lights, the small text, the bright contrast, all of these things are challenges for those who have light sensitivity or difficulty with reading after a head injury.
We're learning more and more that we can actually use physical activity, use aerobic exercise as a treatment for concussion symptoms. So we engage athletes in recumbent bike, treadmill activities to increase their heart rate and increase their aerobic activity. And in our clinical setting, we see that when we apply that, student athletes recover more rapidly and more completely.